Okay, you have 3 seconds of building tension down there. Pull back, get those lats locked in, get those glutes turned on. Tight, tight, tight. Big breath. Go. Control back down, RDL to the knee. Squat it down from there. How was that?
Nothing on the right.
No pain on the right. So from 7 out of 10 pain to no pain. That's how we do it.
Tanya is a powerlifter who came to me with chronic low back pain. Now, this problem had been going on for many years. Starting when she was in her early 20s, she was told she had degenerative disc disease. Every 2 years recently, she had been receiving radiofrequency ablations to block the sensation of pain from the nerves in her lower lumbar spine, but her pain continued. You see, most injuries that occur in the weight room are due to poor technique or inappropriate loads when lifting. Over time, poor movement and or loading habits create tiny amounts of trauma to your body that eventually culminate and lead your body to tip over the proverbial tipping point into injury. During our ensuing evaluation, I assessed her movements, postures, and how she handled different loads in an attempt to classify her pain into a movement-based category like you see here. Before we got started, I reviewed her lifting videos, and as you can see, she often used a grip and rip approach to deadlifts and fails to create sufficient stability, leading to different energy leaks like the knee cave you see here. I started our evaluation that day by having her perform a basic bodyweight squat, and as you can see, she has a significant hip shift to the right in the very bottom. Next, we did a seated compression test.
Now, you're going to start by sitting with good posture. So just straight up and down, put your hands underneath the chair. Now from right here, I want you to pull up as hard as you can, trying to compress your spine straight down into the chair. So pull, pull, pull as hard as you can. Does that create any pain?
No.
Okay, I want you next to overarch your back. So big arch, now do the same thing. So pull up there, arch, arch, arch. Good. Any pain?
No.
Okay, round your back. So round, round, round. Good. Now do the same thing. Pull up as hard as you can.
A little bit.
That creates some pain right there.
Mm-hmm.
Okay.
After, I tested her hip mobility with the Faber test, and as you can see, her right hip has a significantly less ability to extend and externally rotate compared to the left. I immediately had her try the assisted hip airplane, grabbing the bar for balance and opening her hips until she felt a good stretch in her right hip. After holding for 6 reps of 5 seconds, I retested, and you can see now she was able to show much more even mobility. With these tests, I was able to form the hypothesis that her symptoms fit into a flexion intolerance category with associated hip mobility asymmetries. After figuring out her individual triggers and assessing any mobility imbalances, the next step for the rehab for back pain is to enhance core stability. We started that day with the McGill Big 3, a combination of modified curl-ups, side planks, and bird dogs that place minimal load on the spine but enhance the overall stability of the trunk in a 360-degree manner, similar to how guy wires support a radio tower. Next, I wanted to assess her movements.
So sort of running through an air RDL.
Lower back,
Okay.
hams,
Okay.
more hams.
Okay. So a lot of back at the very start.
Mostly hams.
Mostly hamstrings at the bottom.
Yep.
Okay, and then coming up.
Quads
Okay.
and a little bit higher up the back.
Okay. So at the very start, when you went over, you could feel your back.
Yep.
At the very
Stretch
start.
right here.
Okay. So here's what we're going to do. We're going to do a plate-assisted hip hinge.
Okay.
The idea behind this is to teach your body the proper activation sequence of getting the posterior chain to do the extension and not the back. We are going to take a plate, and this is a 25-pounder. You're going to hold it by your hips like this, and you're going to pull it into your glutes. And you are going to, so step 1, create that external rotation torque. Step 2, you're going to pretend like you're pushing it into the wall behind you.
Okay.
So pull it into your hips, and then push that as hard as you can behind you as you go down. Okay, so you're actually going to be forcing it into your hips. So step 1, hips, good. Step 2, push your butt back, try to smash that weight into the wall. And go slow, as hard as you can. Do you feel your legs trembling a little bit?
Yes.
Okay, and then slow back up. Very good. So your goal during this is to create as much physical tension as possible in your legs. So you're starting pre-tension by turning the hips on. sort of spreading the floor, screwing the feet into the ground, whatever cue works best in your brain. And then second, you're going to think about smashing that weight into the wall behind you and going super slow. As if I were to take that plate away, your hips would just smash back into the wall. That's how strong I want you to feel like this contraction is. Okay? Try again. Very good. And then slow back up. Do you have any sensation in your low back with this?
No.
Do you feel your hips?
Yes.
I next wanted to teach her how to properly engage her lats for stability during a hinging motion.
I'm going to pull back like this. So imagine basically holding a bar by your side. And in pulling back like this, you're activating your big lat muscles that run up right here. Those lat muscles need to be turned on to create super stiffness before the bar is pulled from the ground. So I'm teaching you how to do it from a top-down method.
Okay.
So we're going to do this. We're going to go brace, pre-tension, lats turned on, and then you're going to hip hinge from here. So it's butt back, forward, and just a small hinge, and then back up. Using those exact same sequences that we did before. And in doing so, you should not feel your low back. That same sequence. You may not feel your hips and your hamstrings as much because we're not shoving the weight against your body, but you should be able to do this in a way that does not create any back stiffness, and you should feel these muscles working nice and hard the entire time. Okay, try that. Pre-tension the lower body. Good. Brace, nice and strong, good breathing. Engage the lats, nice and strong here. Go through your hip hinge. Butt back, chest forward. Good. Control back up, keep everything nice and stiff. Once you're at the top, then you relax. How did you feel?
Here to here, working.
Very stiff. Good. Did you feel anything in your low back?
No.
Very good.
We then grabbed a kettlebell and worked on our deadlift technique sequencing, working on how to properly stabilize.
What we're going to do, we're going to start at the top. You are going to get stiff ever before you start your descent, just like we did with all those sequences before. So it's pre-tension, tight here, okay? You're going to pull slowly lower, and then once you get your hands here, you're going to pull yourself down, okay? Pull back on this, so it's going to be right between your feet, just like a barbell would. You're going to, before it ever gets pulled, you're going to be pulling back so hard into you that the bell will actually lift from the ground maybe a little bit. But I don't want you to lift it. We're just going to be focusing on getting stiff there, and then relax and come back up. You're not even going to pull the bell from the ground. So this is what it's going to look like. It's going to be a little bit more of a squat to get down there just because of how small it is, but it's going to be here, brace, down, okay, here, grabbing it hard, tensioning, tight, 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 and we'll lift up. And I feel my hips quivering in the bottom. Control, very good. Nice, okay, once you grab that bell, okay, just try to break that bell, tight, 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 tight. There's much tension there, driving those knees out the side. Squeeze the glutes, you feel the glutes quivering?
Yep.
Good, then relax. Come slowly back up. Was that a better one that time?
Better.
Good.
Lastly, I wanted to teach her how to optimize her deadlift capacity. Now, earlier in the day, I had her deadlift this 135 pounds, and she told me it created 7 out of 10 pain. So here she is trying it again in the same day with some new cues.
Pull back on that bar. These should be tight. Drive those knees out. Glutes should be firing, quivering right now. As tight as you can, but don't lift that bar from the ground. Then relax your hands, okay? And slowly stand back up. Does that feel okay? Okay, you have 3 seconds of building tension down there. Pull back, get those lats locked in, get those glutes turned on. Tight, tight, tight. Big breath. Go. Control back down, RDL to the knee. Squat it down from there. How was that?
Nothing on the right.
No pain on the right. So from 7 out of 10 pain to no pain. That's how we do it.